All right. So yeah, I mean, just to jump into things, yesterday was the day for the emergency room. What was that like for you guys? Was that emotional?
It was heartbreaking, the loss for our community. And we've had struggles before. We've always risen to the challenge. We've always prevailed. And to be going through this during this moment, it's heartbreaking for the loss of the ER services
And
that we
it's
have here.
absolutely, and it's just to kind of, paint the picture. It's not just the ER services that are going as we reach into this next month. Pretty much everything else is also shutting down, correct?
We do have a phased plan. We started with the ER. That was the most heart-wrenching part of this whole process. But our inpatient unit, our swing bed program, will also be shuttering along with our ancillary outpatient services at the end of October.
So by the end of this month, will there be anything left that people can still, well, I guess is going to be left and what will remain?
Plan to preserve, and we are actively working to preserve our outpatient clinic. So, our family care clinic and our Glenn Family Medical Group, our primary care providers, our specialty services such as orthopedic surgery, GI, cardiology, podiatry, neurology, those gynecology, those will all stay and be available on an outpatient basis in the community.
Absolutely. And but the main facility of it, that's all going to be closed, correct? And
Correct.
so let's talk about how we got here. I was hearing some stuff from earlier this week that I think LaMalfa kind of gave an update around what was going on in Washington. But from your perspective, what's happened? How did this happen?
This has been a little bit of a slow boil, right? So we first got tipped off back in December that this might even be a possibility, and at that time we all thought it was a mistake. We've had the critical access designation since 2001. It was the designation that kept our doors open when we were on the brink of bankruptcy. It's absolutely necessary for our survival at this facility. So when we first got communications that hey, there might be something brewing here, we took it seriously. We did our research, but we thought, hey, there has to be something else going on here. And when CMS, the Centers for Medicare and Medicaid Services, called their meeting in April, there were 25 some odd attendees on that call. And at that point, we really, oh no, this is real. And we did a call to action. We got Congressman LaMalfa involved. We got our leadership locally involved. We got all of our community members to write impact statements and letters of support and protest statements. And we really felt at that time that the human and practical consequences of the decision would overrule the 2 mile distance regulation. How could we be talking about 2 miles distance when the roads flood in the winter, getting on 32 to go to Chico, when our helicopters are grounded during the fog winter months? It doesn't make sense to anybody else. And when it became apparent after our trip to DC that no, CMS is going to hold fast to these rules, it really affected our staff. And our staff have to do what they must do to provide for their families and seek stable employment. And at that point, our staffing became a little bit unstable, and that's when we closed the ER yesterday. But this isn't something that just happened in this administration or the last administration. It's really something that's been creeping across multiple administrations since 2013. And Congressman LaMalfa is absolutely correct. There was an OIG report and it provided some guidances and recommendations. And it appears that CMS is choosing to follow through on that. And it's going to potentially impact a lot of rural, small, critical access hospitals, just like Glenn County.
So it's not just the Glenn Medical Center that have had kind of seen these reevaluations and lost this designation status.
We know Me Memorial, we know Big Bear, we know Cottage, Santa Ynez Valley Hospital in Santa Barbara. We know of a couple of other critical access hospitals that got this same um, uh, review and this same determination. You no longer meet the distance mileage requirements, so we're going to revoke your critical access designation and the associated regulatory relief and funding that comes with that designation. Every hospital is fighting this battle their own way. But to be perfectly honest, CMS had us dead to rights. We are 32 miles away from Calusa Medical Center, and it doesn't matter that that hospital was built in 1974 and our hospital was built in 1950, and nothing has changed in the, 50, 60 years that we've been in existence. It just, we shouldn't have had it in the first place, and they're correct about that. And now we have to figure out what's next.
And so, I guess, yeah, I mean, what is next? I mean, is there any possibility of saving the Glenn Medical Center at this point?
We all focus on the funding. Our critical access designation gives us 101% of Medicare cost of services, right? And if we switched over to another payer model, a fee for service model, we'd be looking at like 60, 65%. So it's a big chunk of funding that we would be missing out on. But the other key aspect of our critical access designation is the regulatory relief that we receive. Most general acute care hospitals are required that have an ER are required to also have an operating room, a serviceable surgery program. And that is in our current infrastructure in the building that we're occupying is not something that we're capable of providing. There's also the staffing component of bringing in anesthesiologists and circulating nurses and all of those highly qualified professions to the community. So our critical access designation, it gives us that relief to maintain an ER, maintain a general acute care hospital, but not necessarily have the same requirements for things that we can't do well. So focus on what we can do well is what the government says. And we were willing to do that. We did that for 24 years. And I believe that we were really on the right path forward to building some new creative programs here in Glenn County, specifically around behavioral health. But what's next without the critical access designation? We can't keep going in this building. It's prohibitively expensive, and to be relicensed as another hospital type from scratch, it's not going to happen. The hope that I'm holding on to is Dr. Oz has announced the Rural Health Transformation Fund, that $50 billion bucket of support that will be provided to rural communities for innovative solutions. And I think we have a concept here for a rural emergency hospital that would really meet the needs of our community. And I don't know how much you know about Willows, but we're an agricultural community. We're the farming community. We grow and produce all the food that people eat. And to not have emergency medical services available to the people responsible for putting food on our table, I think it's a real injustice. So the other thing that our community needs is behavioral health infrastructure. We know the state of California has some funding available through their BCHIP Behavioral Health Infrastructure Bond Program that can help us build a new hospital. And we also know that this Rural Health Transformation Fund program through CMS could help us build a new hospital. And we really envision a rural emergency hospital that allows for acute psychiatric care to really support our community needs here in Willows.
So it's sounding like next steps for you guys is working to garner funding to build a whole new facility.
It is, but it's a lot more of a lift than just the money component. The rural emergency hospital model prohibits inpatient care. It would allow for like a 24-hour crisis stabilization unit, but no inpatient. And what our community really needs is inpatient psychiatric care. We need beds for the folks that were boarding in our ER previously on those 5150 holds. And everyone I work with, they know how hard it is to find available beds in the North State. And we could really build a new hospital model here if we had the support from both CMS and our state legislators to make it possible to make the regulatory requirements between the state and the feds reconcile. But we could also, this hospital could also address a lot of the workforce development needs that we have. One of the most gratifying aspects of my job is working with our educational partners and Butte College and our high schools and seeing our youth grow up through the different academic programs that are available and get exposure to all of the careers available in a hospital. And so really what we're envisioning is something that's holistic for the community and keeps us moving forward and maintaining those emergency medical crisis stabilization services we so desperately need.
And I guess how optimistic are you that that is all feasible to get happen? I mean,
You're
obviously,
saying the subject of the shutdown.
yeah, we just had a government shutdown. I mean, objectively, there is a large growing conflict between the California state government and the federal government, and you're right in the middle of it, essentially. And then also, I mean, even with that rural hospital fund, there's a lot of hospitals across the
Everyone seems to be
country
after
that are
it.
struggling.
We've been told that because we have shut down and we're losing our licensure, or we're suspending our licensure, that we're not eligible for those funds. So it's going to be a very, very heavy lift to get everybody on board with what we need to do, both from a funding perspective, an operations perspective, and a legislative perspective.
So the last you heard from the federal government was that they didn't even think you guys were going to be able to get any of that funding.
That's my understanding, but it's still very, very early in the process. We've submitted our responses to any of the surveys that have come through, and we're working with our state office of rural health and HCI on our application, as well as our community partners here to get something cohesive for our community.
And when does that, I think, doesn't that funding become available December? Is that correct?
It's happening pretty rapidly.
So I guess, do you guys have to have that pitch? Like, do you have to convince them before that money comes out, or how does that work?
We haven't done any of this before. We
Right.
haven't shut down a hospital before. This is new to our group, but building something is also new to our group. We recently just broke ground on a 16-bed pediatric PUF out in Gridley, California, with our sister hospital, Orchard Hospital, and we're really excited about expanding pediatric psych services in the North State. So we've dipped our toes into kind of these big projects, and I think this is something that we're ready to take on. But getting our state senators, getting our congressmen, getting all the different players at the table and working cohesively, it's going to be a heavy lift.
And then I wanted to ask you this because last week I talked to the Willows Fire Department about kind of how they're hoping to step in, but again, their stuff isn't ready, is likely not going to be ready until the first of next year, and we're going to be 100% likely closed at least for the next several months before any possibility of funding. How, as someone who works in the medical field, you know, what is this situation for the residents of Willow who are now, how can you talk about, are they at risk? Like, I mean, what's happening for them?
Everyone's really quite scared, and I don't want to be alarmist, but it is very concerning. I live and work in this community. All of my friends and neighbors live and work in this community. It's impacting everybody. And just ask anyone. Everyone has a story about how Glen Medical saved their life. I have a story about how Glen Medical saved my life. It's somebody's father who had a heart attack. It's somebody's kid who had sepsis. It's, the elderly gentleman with hypothermia. It's our strokes and your STEMIs. It, and there's the uncertainty component of you never know when you're going to have that heart attack and when you're going to need services. And a lot of people go to Enloe, go to St. Elizabeth's, use other hospitals in our community, and I love that. But that's when you have a choice. And if you're having a heart attack and you need those services right here, right now, you don't have that choice. And so everybody's a little bit concerned. One of the benefits of having the hospital in county is the quick turnaround on our ambulances. Somebody goes out to a call, they drop them off at the hospital, and then they're back to base in a matter of minutes, ready for that next call. Every ambulance and 911 call is going to take that rig out of county to one of the neighboring county's hospital, which is going to mean that we are one bus short for that duration, 3 or 4 hours at a time.
Wow.
Same thing for law enforcement and any of our justice involved folks. The hospital previously did all the legal blood draws and medical clearances for folks going through the jail process. And now those officers are going to have to do that process either in-house somehow or take them up to Enloe or one of the neighboring facilities.
Oh, wow. And I guess, as kind of the administrator, you kind of expressed this at the start, but how does it feel to see what is now happening to your community in a situation that you guys really didn't seem to have much control over?
We didn't have any control, and that's really the kicker for me is as we went through this process, I had moments of genuine hope. I A part of me knew from the jump that we never had a fighting chance here, that the decision to move forward with this process with CMS, it's been going on for a while now, and it was set. But there were moments when I really felt like we had a chance where maybe if we had just a little bit more action or a little few more letters or another couple more phone calls, maybe something would have made a difference. And I know that that wouldn't have happened, but it's heartbreaking to know that so many people in our community counted on us and rely on us for not just emergency medical services, but part of, their extended family, their careers, and all of that is being lost right now. And we all feel so powerless to stop it. I hope that people who have agency to help us fix this can listen and then actually bring a solution as opposed to just blaming everybody else for why this is happening. It doesn't matter how this started, it's happening now. And the blaming and the fighting, that doesn't help anything. We're just getting lost in the middle of it.
Absolutely. And then I should ask this earlier, how many people were employed by the Glen Medical Center?
We're a small hospital, so we have about 225 employees total, but that's a pretty heavy per diem roster. We scale
Mhm.
down to about 150 folks, full-time, part-time.
And then do you guys have an idea of where you'll be at after the end of this month? Or
Hoping to keep our inpatient swing bed program open at least until October 21st, hopefully into November. Part of the reason why we're doing that is for care planning and patient care. Our swing bed patients will come to us after a stroke or a broken hip, and they're here for like 2 or 3 months for rehab services, physical therapy. And we don't want to transfer them out in the middle of that, especially when they have a good rapport with their therapists. But the other aspect of keeping our swing bed open a little bit longer is it allows the remaining staff, especially our non-credentialed staff, a little bit longer time to find that next opportunity.
okay. I think that is all the questions I had, Lauren. Is there anything else you feel is important to mention? Anything I haven't asked you?
We're just so incredibly sorry that this is happening. We feel very much that the loss that is taking place. We hear our community. We know, we understand the frustrations people are having, and I don't know what the future is going to bring, but we are committed to providing access to healthcare services in Willows, California, and Glenn County, and we will continue on that mission. And it's going to look different for a little bit, but I'm remaining hopeful that we can have something positive come out of this experience.
Absolutely. Well, thank you so much, Lauren. I appreciate you giving some time.
Thank you, Max. I appreciate it.
All right, good luck with everything.
Bye
Thank you.
bye.